Hello and welcome. Today we're diving into a rare and often overlooked condition, bladder sarcoidosis. This video will explore what it is, how it develops, its symptom diagnosis and treatment options. Join us as we unravel the complexities of this unusual manifestation of sarcoidosis. The exact cause of sarcoidosis, including bladder sarcoidosis, remains a mystery. It's believed to be triggered by an overactive immune response to an unknown antigen. This antigen could be an infectious agent, environmental factor, or even a substance produced by the body itself. In susceptible individuals, this leads to the formation of granulomas, which are clumps of inflammatory cells in various organs. The bladder is an infrequent site for these granulomas to develop. In bladder sarcoidosis, granulomas infiltrate the bladder wall. These granulomas disrupt the normal structure and function of the bladder. The presence of granulomas can cause thickening and stiffening of the bladder wall, reducing its capacity and ability to expand. This can lead to various urinary symptoms. In some cases, the granulomas can ulcerate or cause inflammation around the ureteral orifices, so where the ureters connect to the bladder, potentially affecting kidney function. Bladder sarcoidosis is an extremely rare condition. Because sarcoidosis more commonly affects the lungs, lymph nodes, skin, and eyes, bladder involvement is often missed or misdiagnosed. Precise epidemiological data is scarce due to its rarity and the difficulty in diagnosing it. It's typically seen in individuals already diagnosed with systemic sarcoidosis, but isolated bladder involvement, though exceptionally uncommon, can occur. The symptoms of bladder sarcoidosis can vary depending on the extent and location of the granulomas in the bladder wall. Common symptoms include increased urinary frequency, urgency, a sudden and compelling need to urinate, dysuria, painful urination, and hematuria of blood in the urine. In severe cases, reduced bladder capacity can lead to urinary incontinence or even difficulty emptying the bladder completely, potentially causing urinary retention. Diagnosing bladder sarcoidosis requires a combination of clinical suspicion, imaging studies, and tissue biopsy. Initially, a doctor will review the patient's medical history and conduct a physical exam. Urine tests can rule out infections. Imaging studies, such as cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, and CT or MRI scans can help visualize the bladder wall and identify any abnormalities. However, the definitive diagnosis is made through a bladder biopsy, where a small sample of tissue is taken from the bladder wall and examined under a microscope to confirm the presence of granulomas. Other conditions like bladder cancer or interstitial cystitis need to be ruled out. While sarcoidosis itself has classifications based on the organs involved, pulmonary, cutaneous, etc., bladder sarcoidosis does not have specific subtypes. The severity can range from mild with minimal symptoms to severe with significant bladder dysfunction. But this is more a spectrum of presentation rather than distinct classification. The treatment for bladder sarcoidosis aims to reduce inflammation and alleviate symptoms. Corticosteroids, such as prednisone, are often the first-line treatment to suppress the immune system and reduce granuloma formation. Immunosuppressants, like methotrexate or azathioprine, may be used if corticosteroids are ineffective or cause significant side effects. For localized granulomas, transurethral resection (TURBA), a surgical procedure to remove the affected tissue, may be considered. Supportive measures, such as medications to manage urinary frequency and urgency, are also important. Regular monitoring of kidney function is necessary, especially if the ureters are affected. Since the exact cause of sarcoidosis is unknown, there's no specific way to prevent bladder sarcoidosis. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may help support the immune system and potentially reduce the risk of developing sarcoidosis in general. If you have been diagnosed with sarcoidosis, regular check-ups with your doctor are crucial to monitor for any complications, including bladder involvement. The prognosis for bladder sarcoidosis depends on the extent of the disease and the response to treatment. In many cases, with appropriate treatment, symptoms can be effectively managed and the bladder function can be preserved. However, in severe cases, persistent inflammation can lead to chronic bladder dysfunction. Research into sarcoidosis is ongoing, focusing on identifying the triggering antigens and developing more targeted therapies. Some recent studies are exploring the role of specific immune cells and inflammatory pathways in sarcoidosis, which may lead to new treatment approaches in the future. It's important for patients with bladder sarcoidosis to work closely with their healthcare team to optimize their care and improve their quality of life.